Hi, everybody. Welcome to Hey Doc, your podcast on youth mental health and all youth mental health related topics. This is just, a podcast is a big name for a conversation. So let's just align expectations over here. We're going to have just conversations with interesting people and different people about mental health related topics. I'm Vinny. I'm a physician from Brazil, and it would be a pleasure to be with you all here today just to talk with our different guests and have different conversations. I know a first question that always comes is, Vinny, isn't Hey Doc with an H? I know. Hey is supposed to be written with an H, but you're in Brazil, babe, so that's how we roll. It's without an H. Anyways, we have such a special guest with us today. He's a friend of mine. He's a great person. He's amazing. His name is Victor Hugo. Everybody tends to call him Victor Hugo, but it's not Hugo. It's Hugo. I've heard that. And let me introduce him. He has this huge bio. As I was prepping the episode, I was like, I'm going to introduce Victor because he's done everything everywhere all at once. So I'm like, okay, so please tighten your seatbelts. I'm about to read his bio. It's a lot, but please stick with me. So Victor is a mental health advocate. He's a leader in the conversation about youth participation, leadership, and innovation. He's the founder of Money, Mentally Aware Nigeria Initiative, one of Africa's largest youth-led and user-led mental health networks. Victor works facilitated the revolution in a way many young Nigerians talk and think about their mental health. He's a skilled team lead. He has dedicated a lot of time into promoting community participatory approaches to research design and dissemination in low and middle income countries. He has built strong relationships with professionals, policymakers, funders, as well as key organization stakeholders in the lived experience, adolescent youth, policy development, and community participation programming, advocacy, and research. Do you think that the bio is over? It's not. He's done way more than that. Let's just keep going. Just long story short, he's currently serving as the MHPSS and Youth Engagement Advisor for the MHPSS Collaborative, hosted by Save the Children Copenhagen, Denmark. And he's now dedicated to building infrastructures that enable young people to lead and participate authentically to ensure context-relevant approaches to their well-being. So, he's the guy, okay? We're going to have such a great conversation today. Let me just pass the word to Victor so he can say hi to everyone. Welcome, Victor.
Thanks a lot, Vinny. It's really such a pleasure to be part of this conversation. I think when you reached out to me and I saw a podcast invitation, I was like, yeah, yes, I can do this one. Because I have I have been part of a couple of podcasts and of course looking at how much time I have and don't have because I have a 16-month-old kid now. It's just like how much can I actually invest in taking on the extra commitments? But yeah, it was I think based on our relationship and the things that we've been part of together, I just thought that this was going to be a good opportunity to have a chat on something that we're both passionate about.
Victor, thank you so much for being here. I feel like we have so much we can talk about. So much. Guys, when I say so much, it's like so much. Much. But I think we
Like,
can really talk about lived experience and advocacy, the importance of peer support and community support, engagement of people with lived experiences and the local community, and advocacy and research and how to design interventions, and youth mental health specificities for low and middle income country settings. There's so much we can talk about. We're going to be here for days. Just fasten your seatbelt. Just enjoy. This is going to be a huge conversation. I feel like the first question that I want to ask you is, can you please share the inspiration and kind of like the process behind founding the Money, Mentally Aware Nigeria Initiative, and how it has impacted the perception of mental health among Nigerian youth? I'm a huge fan of this work, so please, the stage is yours.
thanks a lot, Vinny. I think, as this question has evolved over time, in the past it was a very straightforward response. But I feel like the response is whenever I think about and reflect on questions like this, it's always in hindsight. If I knew how much of of a journey, a stressful journey, a very intensive learning experience that was going to be for me, maybe, maybe I would have, maybe that I would have, I've done something else. Maybe could have stayed back in my medical practice. But I think it's been such a very life-defining experience. For me, the reason why this organization became a reality was obviously I think it's 30% based on my own lived experience because obviously I think everyone who's inspired by lived experience, you have something that you're passionate about, something you've lived through. It makes a huge difference in terms of the passion that actually keeps you going, which is such a huge thing, is such a huge deal. And one of the biggest advices I give to mentees these days is if you don't have anything that's going to keep you dedicated to this vision, then maybe you should consider joining someone else's vision, someone who has that drive, because otherwise you're going to find that you're going to spend a lot of time and resources that wouldn't be something that you would appreciate over a long time. So but yes, 30% my lived experience. I was diagnosed with depression when I was in my 15th med school, and I think I was lucky enough, and I always say this is very, I was lucky, I was privileged enough to have friends around me who were very knowledgeable about the condition. It made sense. They were all medical students, right? So we just finished a psychiatry post rotation, and obviously it was kind of easy to see, hey, Victor is not the way that he used to be. Because I'm very like I'm a creature of habit. So if I'm not doing things that are based on the habit that you know me for, then you know that something is wrong, right? So it was kind of easy for them to see that and be able to rally around and say, hey, let's get him support. So I was not diagnosed in the most typical ways. I was diagnosed over dinner with a psychiatry professor of ours. So again, that really shouts, screams privilege, right? But the thing is, growing up and going to a private university, I sort of grew up in that privilege, so I wasn't really aware of what was happening beyond that. I was not aware. It's like I didn't know. I thought everyone had the same level of community, the same level of support from family and from professors in university, like I did, but I was wrong. Even in my own university, I remember seeing different people drop out early enough. Like even in the final year of study, they drop out. I remember having a couple of people who killed themselves, and it just never clicked that they could have been going through something and they didn't receive the right kind of support. So again, that's why I say I was lucky to have the right kind of people around me. My friends went as far as, even having to join and facilitate group therapy sessions that they were part of, so they can know exactly how to help me and how to support me and how just to learn more about the condition and what exactly can be done. And I went through medical school and I didn't have to drop out, which is such a huge deal, actually, because I was just 2 years away from my finals. And then I was thinking about practicing, obviously, and going into surgery. I was very much going to become a neurosurgeon. That was my whole drive. But one of the days that I went to see a psychiatrist, um, and he said, "You're a doctor, right?" I was like, "Yeah, I am. At least I just finished." He said, "Oh my God, you're so lucky. When were you diagnosed?" I was like, "Oh, a year, 2 years ago." You were diagnosed in medical school? Yes, I was. And you finished medical school? Yes, I was. Yes, I did. I was like, yeah, you were so amazingly lucky. Now, this didn't make any sense to me at the time because I was going back to him. I was going to see a new psychiatrist because I needed to change up my meds. I needed to have I felt like I wasn't having new symptomatologies. Like I was having new symptoms that I couldn't really deal with, or at least understand. So again, I got diagnosed with 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 an anxiety disorder, a panic disorder, and a sleep disorder in that visit that he was telling me that was lucky. So obviously I didn't take it right. And then I got new medications, more medications. So again, there's a cultural thing, like you're not meant to talk back to older people. He was quite old, so I didn't want to talk back to say, wow, what do you mean I'm lucky? What does that even mean? But I went back on my way back. I called my friends. I was like, can you imagine this very you know insensitive psychiatrist who felt it was okay to tell me I was lucky after giving me a bunch of meds and new diagnoses that I was still coming to terms with. And of course, my friends are on my side. But then my mom, she's my confidant. So she told me, I was like, I understand what you're saying, I understand where you're coming from. But being Nigerian and also knowing the system, again, like I mentioned at the beginning, I didn't know enough about the system. I just knew about my community. That you're part of the very few people who could get that kind of support. Maybe you should do your own research. So I did. So I spent a month reading on the internet, trying to find existing non-profit organizations or charities or government programs that were focused on promotion and prevention of mental health programs in young people. And here's the funny thing, I didn't find.
Oh wow. I love how moms are. My mom's exactly the same. I'm like, Mom, this person told me that she was like, no, no, no. let me tell you something, and then comes with like this huge thing. I'm like, Mom, you're not
Wisdom,
my
yeah,
therapist. Can you just cut this out? I need to come
exactly.
with my own conclusions. Let me think by myself. Anyways, I don't interrupt you. Go on. And you were researching, and then nothing comes up.
Yeah, so I didn't find. I mean, I find a couple of pages on Facebook. I mean, Facebook was very popular at the time, but they only had posts on World Mental Health Day and World Suicide Prevention Days. Like those were the only days where they got active visibly. And I thought if you were creating mental health programs for young people, and then we have social media that young people use a lot, then you should definitely be targeting the place that they spend most of the time in. Social media is schools, high schools, and universities, and I didn't see as much of those programs. And the kind of programs that we were creating at the time was much more about symposiums and seminars. And dude, when I was in school, I hated symposiums. Like, what am I doing there? I'm spending 2 hours listening to someone give a lecture that
I know.
what am I going to do with that? It's like it's the same thing I thought for most young
I
people.
know.
There's no fun days. There was no fun
Yeah. If you're a
in it.
teacher and you're
You
a
just sit
professor,
down.
nothing against you. It's just that sometimes
Nothing.
seminars
It's nothing
aren't,
personal.
the things we're interested. If you bring like a PS5, an Xbox, or maybe like some games, maybe that will make it work. But I mean, 3 hours, 3 straight hours of like just lessons. Anyway, I got you.
Nah, that won't do. That won't do. So I thought, how exactly do I counter this? What kind of organization would I create? Now, I wasn't looking to build a new organization. I designed a model that I thought could work, and actually went to a symposium by um, an association of psychiatrists in Nigeria. They invited. I reached out. First of all, in the thing is that I don't know what your culture looks like, but when I reached out, I didn't get any response. But then I reached out to a friend of mine, who was a Nigerian, and he said, "Oh, hey, I know a professor in this university who actually is, well known, well published. Maybe I can make a connection for both of you." And he did. And then he said, "Hey, we have a symposium coming up in this place. Do you want to come down?" So I flew down to the state. I went and I sat down and I did a presentation of the model. And here's the thing, after the presentation, they thought, this is really interesting. I said, I'm not trying to build a whole new organization. I can fund myself. I can come to your organizations. I can train you on how to use these models and approaches. Because I didn't think I had the time, to just start my own from scratch. And I always look to invest in already existing programs. Even at the time, I was quite young. And they said, sure, 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 here's my card, give me a call, send an email. Now, 3 months after doing that, I sent all the emails, I made all the calls, no one was responding. So I thought, okay, I think one night after just giving it a long thought, I just told my friends, hey, I'm just gonna pause clinical practice for a bit and try and do this myself. And I need a couple of people to be part of the director's board for formal registration. And my friends, of course, are like, sure, 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 let's do it. Sounds exciting. It sounds like we did a lot of fun things in school. Like, sounds like one of those fun things. Let's do it. So we came together and we did it. We got registered.
They had no idea how much work was coming their way.
Honestly, yeah, exactly. I think one of them, kudos to them. They were very supportive to me. But I could also understand, working directly, in hospitals, you don't have as much time for yourself, which means you might not even have time for, obviously you don't have time for anything else. So it became like a one-man thing with support from people who could say, hey, how much money do we need to raise this time? We usually raise money internally. Um, and then we started with some initial campaigns to reach out to celebrities and influencers to say, hey, we want you to contribute to the message around mental health. We are using social media as an approach to creating awareness. And here's the thing is, when we started, we focused solely on awareness in our strategy. We had awareness for 3 years, and then we go on to something else. Now it felt right, it felt appropriate for the context that we're dealing with. But when we 6 months into raising awareness, we had people reaching out to say, "Hey, now you have told me what I'm dealing with, but you haven't told me how I'm meant to deal with
And
it."
you're like, Mom, please come pick me up. I'm only 6. I have no idea what I'm doing here. Yeah, I know.
So, well, thankfully, before then, we had a couple of volunteers who we had registered in different sort of like mental health first aid program, a couple of trainings online. Um, the suicide safe trainings. We took some of those ourselves and we got more people registered. And so when we started getting those messages, we had to quickly transition into the next stage. And then we had a phone line. Now we don't have a toll-free line for reaching out for mental health in Nigeria. It doesn't exist. So what we did was we had the resources, we had our own funding, which was quite substantial at the time, and we basically recharged, like the call line. And if you call us, you don't have to call, you can just flash or you can just send a text like, I need help, you need to call me, and then we call you back. So it was toll free, but it was reverse toll free. So it's like a reverse toll free line, right? And then we did that for a while, and then we're taking manually taking track of all the people that called in, the gender that was calling in, and we found that 85% of people that were reaching out to us were men and boys, and no, we're women, and 15% were men and boys. So we thought, how do we counter this? So again, process of researching and trying to find out what's the right way to go. We did a whole brainstorming session. What are some of the barriers to entry to reaching out for young boys and men? Of course, very much like the same thing about stigma and men not crying or not being expressive or being macho and all of that alpha male thing that is very cultural in our society. And then we changed the model. We sort of added in new concepts where we went text-based instead of call, because it makes sense. If you're a guy and you're calling and your guys are around you and you're calling someone, say, hey, honestly, I'm depressed, like they'll laugh at you. They make jokes at you. They might even give you new names and nicknames. That's not something that young boys want to be attached to them. But when it came to text over WhatsApp, you can just send a text and just close it, right? Like no one knows what you're texting. You can lock your phone, have a new password. We didn't have face ID then, so no one can actually, no one can mistakenly just like get you to unlock it or even tamper it. They didn't exist. So we started seeing a shift. First of all, we had a 200% increase in people reaching out to us, which is huge. And then we had a shift down to from 15% to 35%, and then it stabilized at 45% a year after. So that's sort of like the journey that gave us more or less like the most useful intervention, the most useful innovation that has been the most used. The thing that's really made us popular in the country, in the continent, is that service, that text-based service that we offer people. In terms of the actual mental health programs that we did, um, obviously we went the fun way. So we have something called Conversation Cafe, and it's just a conversation that you get to have with other young people. It's meant to be for 2 hours, but 1 hour is the conversation about mental health, and you get to sit down at the beach or in a very fancy restaurant and just chat about depression, but not from not the jargonized ways, like, what are common things that you would feel, very, very casual, very laid back. And the remaining 1 hour is just like get to know each other. So obviously young people always like that socializing aspect. It was fun for them. They get to make new friends. We had a couple of people who got married off of that a couple of years after, which is something we're very proud of.
That's so nice. You go for mental health support, you end up with a
So
partner. That's like a win-win situation.
exactly, exactly. It's like a community, and the volunteer community was huge. They were very supportive. Um, and then, yeah, that's basically the trajectory of growth of Mani as an organization.
Wow. Do you have like just out of curiosity, do we have any like numbers on the amount of people that have participated or like any estimate?
Oh boy, I mean, the conversation cafes, they were happening over 18 states in Nigeria. So Nigeria has 30 states, 18 states, and I think it was happening every month, I would say. And you will have more than 1,000 young people
Wow. That's a lot
across
of
the
people.
different, much more than that. But it's like the minimum was 1,000 across the different states at the same time, managed by volunteers, from like, we give them manuals and guidelines, like, this is what the the guide should look like, this is what the facilitator should say, this is when you get them to get the pens, this is when the flipboard and the chat should come up, and then pre and post surveys and things like that. So it was really just very volunteer driven, community driven, young people driven, and fun, which is the most important component, right? I mean, I went to a couple of those. I fancied a couple of those, and I can tell you, like sometimes I went and I thought and just thought, this is the innovation that we came up with, but it's so much more fun than we thought it was gonna be. We thought it was just like, let's have a conversation very casually and let's get to meet people, but sometimes it became things where people can actually spend this, they can spend a lot more time than we thought they would. So
That's so
that
nice.
was that was, I mean, that's for the conversation cafe. Yeah.
I mean, I relate so much with your story. With a lot of things. I mean, I haven't done anything like money in Brazil, but I mean, your story as a person going through mental health struggles at university. I mean, medical school sometimes can be a little bit tricky.
Oh
There's so
boy,
much. Sometimes there's
every time.
competition. There's a lot of coursework, and there's this emotional load of like being there for people and people that are vulnerable at some time. So you really need some sort of support system, the one that you mentioned, just to make sure that you're okay, right? And that's a good tip for everyone that's listening. If you're able to have some sort of support system anywhere you are, just go for it. This could be your friend, this could be your family, this could be a person you know, anyone you feel like you can trust, just to share a little bit of your journey. Because I know that sometimes it's kind of hard to go through stuff by yourself. So if you have anyone that can become your support system, please, 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 just go for it. And it's very, very interesting. I mean, we differ a little bit because I've heard this gossip, and this might be just a gossip, but I've heard this gossip that you've decided to become a surgeon because when you were a kid, you were playing video games, and then someone came in and said, "Oh, steady hands, you should be a surgeon," and then click, you become a physician. I've heard that you were a kid that has read a lot of books. That was very always very interesting in reading stuff. Very interested in reading stuff. And I'm a little bit different from that in the sense that I just found out that I really wanted to be a doctor just very later on. But one thing that I like to point out in your story is that you're really highlighting the importance of engaging people, like engaging the community that you want to serve or bringing people to the table. And I really like to hear from you. How does it work? I mean, because I feel like whenever we're talking about mental health interventions, a lot of time we hear about different interventions that kind of like come top down. So there's this small group of people that think, hey, maybe we could do this, and then they start executing this without actually engaging the community around them. So I'm very interesting to know now at this point in your life and career, how do you see real engagement happening? What are the best practices? How does this work?
Yeah, I think the thing is most times we accrue concepts like engagement to very bogus and very like complicated, terms, but they're not. Like they're quite straightforward. If I'm trying to sell a product, I do my market research. That means I get to consult with a community of people who I expect to buy the product at the end. It's very straightforward. It's still part of the society and societal constructs, right? But when it comes to interventions and programs that charities do and non-profits and even governments and funders, we don't think about that as market research. Like we think of market research as trying to find out those that could benefit from this, but it's more than that. It's actually having people to test out. If I'm playing a game, I've been beta testing some games that I love, like Football Manager and a couple of those. When I test the game, I say, this is what I would like to see when I'm playing the game for real, you know? But it's my game. Like I'm playing it, and I still have to pay for it. But I'm offering that advice, which I think is just going to make my gameplay a lot more wholesome. But that applies to everything in real life. If you want to do something that is going to be very, very useful for those that you're targeting, then you need to make sure you're consulting them. When we initiate the first, before we even, I think I forgot to mention, before we even design the strategy, we got together in something called we called it Eat Out to Reach Out. So it's like a couple of 300 young people in the same place, eating, laughing, playing, but also, brainstorming and helping us think through what kind of strategy we should apply. And that, I assure you that was the landmark. That was the foundation that we built on. Because if we didn't hear from them that they would love to learn about this, and this mental health conditions in this way, and they even told us how to do it. Like, every month you can focus on a different mental health condition. And, that whole month exhaust. I want you to exhaust everything related to depression. I want to know everything about depression, from the symptoms to the signs to, different ways that people present to postnatal depression, even if it's not directly related to what they want to hear at the time. They have relatives that can actually benefit from this thing. So we could have just gone straight forward with just like, here's something we copied off the internet and here, use it. We're just providing it to you. But we had to make sure we converted every of those, you know, information, every other information that we had into very relatable content, questions, quizzes, vox pops on the street, like asking people about their existing knowledge. It was just as in-depth as they wanted it to be. And that made the biggest impact in terms of how young Nigerians actually thought about mental health. Started talking about it. In fact, we got to the stage where we had people on social media who we identified as spotters. So you know how in the US, like, you have spot, not just in the US, in some like, countries where you have very long bridges that have a high risk of people jumping from them. They have people trained as spotters. So they spot people trying to jump and they try and help them. So we had a social media version of Spotters who actually sees posts on social media, on Twitter, on Facebook, on Instagram from people who are actually in distress. So like it's like we get so many messages like this person's tweets are looking very weird. Do you want to reach out to them? And we do. So we actually had the Spotters on social media, and it was very an organic process. We never really sought out to create that kind of environment, but because we had framed ourselves as people who have the information that you can relate to, but also can provide support. It was, it made sense that that was like that was the pathway that people went through. And we still have lots of those. I think there was a time when we even did more or less like what do you uh, sentiment analysis on social media to understand, to make it easy for people to identify keywords, right? That we can now use to, redirect people to our pages. If we know if a keyword comes up on the app, we can just reach out directly. But before we even got to the stage of using sentiment analysis on social media, we had individuals that were doing the spotting for us.
That's so nice because it kind of like shapes a little bit the way that we talk and think about mental health. Because I feel like one thing for me, for instance, there's still a lot of stigma on mental health. Like ever, despite every effort that we have going on today on social media with celebrities and like programming work, there's still a lot of stigma going on. Even for me, I mean, I'm not a physician. The first time I went to therapy while going through medical school because struggles, and then it was this huge process of me, just like this huge internal process of like, okay, maybe therapy could be a good thing. Maybe therapy isn't that bad. I mean, therapy is awesome. Okay, I need to say this directly to camera. Let me tell you something, listener. I even need to position myself a little bit better. Therapy is such a great thing. If you're able to do therapy, please do therapy. I mean, for me, it was such a huge struggle to start doing that. And I wonder, you've you've done so many different actions and you've participated of many different programs. What do you see as a pathway for the future in terms of stigma? What do you feel like we haven't done already that we should do more to address stigma? Because I feel like we've tried so many things, but there's still so much stigma going on. What's the pathway forward?
I'm gonna go a very different approach, which is something that sometimes I actually shy away from. I decide not to express that because it's very different. I told people, I think it was Massey, a couple of people that we're friends with, and I said I'm an anti stigma, advocate. Like the whole campaign against stigma, the whole branding, we have to use education to push, we have to correct people when they say this bad, this is not how you say it. The whole idea of stigma as as something that you punish, it's not really the pathway that I actually more or less like had the epiphany of. So I always think about stigma as a consequence of society, you know. If you live in a society where people are a bit more open, where the government and policies in place are actually, facilitating access to mental health programs and early access and early prevention programs, you would find less of stigma. You would. It's just it. It's basically what the science says. Um, so I think about stigma from a perspective of what are we not doing? What we're not doing, or we're doing it, but maybe we're not getting as much of a response, is how we're influencing government policies when it comes to stigma. What are those policies that actually affect stigma? What are those policies in workplaces, in schools, in hospitals? Because even in psychiatric hospitals, you still have stigma. So it's not a question of people not knowing. They know. At least some people know. There's information out there. There's education. Um, but when there's no consequence in terms of like, political consequences or societal consequences of stigma of being that person who expresses this to someone who's dealing with this, then people will still keep on doing that. So I'm not saying go towards the punitive measures. No, I'm saying if there's existing structures in place that make it easier for people that are, dealing with mental conditions to find help, to feel safer in the places where they work, the school, they live, then we're gonna have less stigma. On the other hand, social media has been good, but also, in some ways bad, for anti-stigma messaging, because where you have increased information for mental health and people are learning a lot, you also have increased misinformation on social media. I mean, if you go to TikTok, oh my goodness, there's so many unqualified therapists and psychiatrists on TikTok who are providing and suggesting different ways that you can take care of yourself. So if if we don't have those approaches to make sure that people are getting the right set of information and knowing where to seek help and where to get help, again, we're still going to have the problem. Stigma still persists. So I always say that stigma is not the problem. Stigma in itself is a consequence of an existing problem. That's how I think about it.
Wow, that's very interesting. It's very nice to kind of like take a step back or maybe a step forward, depends on how you see it. Seeing stigma as more of a result and how structural changes can really kind of like move the needle forward. Because I feel like we're doing so much in terms of like education awareness, and there's still so much stigma. So maybe the answer isn't in this other way of thinking. But I'm gonna use this as a segue because we have segments in this podcast. It's a show. Come on. We have segments over here. We have the segment that is um, if you were a policymaker, and I feel like that's the best segue ever for this segment. So let me just play the vignette. Okay, maybe we don't have a vignette yet. Okay, so I'm gonna create a vignette at the moment. Da, 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 da. If you were a policy maker, that's it. Okay, that's the best I can do. I'm not doing this anymore. You've talked so much about stigma and policy making. What do you feel like is the way forward? If you were a policymaker for a day, what your like suggestion or proposal would be? And I know this is a very tricky question because mental health issues are very different when you think about like the global north, the global south. It really depends on the context and the issues people are facing. But like given your broader vision, what what do you see like as a policymaker action that we could be doing to improve mental health for young people?
I think a lot of times a lot of policymakers operate in silos. So we have the Ministry of Health operating differently. They have their own programs. We have the Ministry of Education operating differently. They have their own programs. And there's some ministries that are missed out. Ministry of Justice, Ministry of Finance. Where does the money come from? You know, Ministry of Social Welfare, like Ministry of Youth. They always missed out. It's like whenever in Nigeria, you have Ministry of Youth and Sports. So like that's their mandate. And most times they're really focused on sports-based approaches to getting young people away from drugs. That's what they say. From drugs and substance use and abuse and substance use disorders. I would use a multi-sectoral approach. I bring all of these people to the same table and we will create a multi-sectoral strategy to approaching this. I would think about how exactly are we integrating mental health into the curriculum into the educational curriculum, but not stop there and look at the environments as well, the enabling environments for mental health. It's like we look at the psychosocial determinants of health. They affect mental health. We're looking at, you know, access to livelihood, livelihood standards, living standards of people. We're looking at poverty. We're looking at discrimination, tribal, any kind of discrimination really. We're looking at even the how would I put it, like the workload. of students, how they're dealing with that. We're looking at existing help that students can actually get immediately within the school settings, within the workplace settings, within the community. We're looking at even a very structured and tired mechanism of health. We're looking at, you know, making sure there's a good referral system between primary and secondary and tertiary healthcare systems where you have, you know, probably not doctors, maybe you have community health workers at community health level and primary healthcare level who can actually diagnose mental health conditions and know which ones they can refer, but also have the tools and the resources to deal with the early presentations of mental health problems. For the ones that refer to secondary healthcare centers, they know enough to be able to prescribe medications. And the thing about when I talk about medications, my heart breaks because we're thinking about medications themselves have been so stigmatized in themselves that don't take medications, but that makes sense because in our context the kind of medications that we get, they're still very much older generation drugs that have very, very debilitating side effects. So that's the reality of most people in most low income settings, is that we're still dealing with the lack of access to quality medications, which reinforces the stigma that people are facing. So if you have to take a medication and you're going to sleep the whole day, you're not able to provide for your family and for yourself, you're living in a context where there's huge economical setback, you're not going to take those medications, right? That makes sense, right? Um, and then if you have access to better medications, but they're costly, again, it's like you can afford the things that can actually make you feel better. And the reason is because if you look at the fact that mental health conditions are actually severe mental health conditions, they're very, very sometimes chronic. So long-term care means that you spend more over time. So that's why we should be looking much more at prevention as the how do I put it, like as the road, as the approach and the pathway to actually countering stigma. So we're looking at making sure that within schools, within workplaces, within communities, that we have very clear and very simple and very easy to understand messaging around mental health, and going to see um, a healthcare worker early enough. But you cannot see a healthcare worker if you have to travel, 1,000 miles to see one. That's a bit too difficult. But if you have your primary healthcare center close to you, you can just get off, walk 10 minutes, go in, sit down, get diagnosed, and get help as you need it and when you need it. And you wouldn't have to progress to a much more severe mental health condition. So, thinking as a policymaker, I think I'll look much more at community-based approaches, but that one that integrates all the existing players, educational system, the justice system, the financial system, the parastatals are set up for youth and welfare and social welfare, and then look, of course, at the Ministry of Health. So bringing all of that together in one place and designing strategies that are very much wholesome and holistic. That's why so holistic is the way to go. Um, and they're very much community-based and community-centered, community-driven as well.
Yeah. I mean, wow, that was a loaded answer. There's so much to talk, but but we have a hard stop very soon. So I'm gonna leave this for a part two conversation. Anyways, I feel like just one real quick comment. There is so much we can do in terms of mental health prevention, mental health promotion that we haven't been doing for many manufacturers. This could be resources. This could be, advocacy in terms of like how much of this is in the public agenda. And there are many factors in that, but I completely agree that we have so much opportunity, especially for young people in the context they're in, may that be in the school system or, I don't know, in different communities they belong, doing mental health promotion, prevention work. I feel like this is something that can really make a lot of difference. And just to kind of like wrap things up, we just have another very quick segment that is questions from the audience. Is there an audience at this point? No, there isn't, but there is a sister. So I have a question from my sister. She's currently 17 and she heard from the episode and she was like, okay, I'm going to send you a question. Do you have any advice to offer for young individuals, young people that kind of like want to become advocates in this field of youth mental health? I feel like you've been everywhere, you've done everything, you've been a part of many things. So what advice would you give for, my sister or any young person that would like to start an advocacy journey in youth mental health, what is there to be said?
I mean, I wouldn't go, wax philosophical on this. I think one of the biggest problems that we have is the starting, to just start. Find a good group, find a good um, organization or a good pathway, a group of friends who are just as passionate as you are, and start the conversation. But make sure you inform yourself well enough about the conversations and the topics that you want to be tackling, um, because that's very important. You're going to be asked questions by people who reach out to you or who you're targeting. Um, Make sure when I think about advocates, it depends, in what way are you looking much more at, you know, advocacy based on knowledge and awareness, like to the public, or you're looking at advocacy to policymakers. So you can even start reaching out to policymakers in your own community. Most times we think very big, we think the impacts that we make at the national level is the only kind of impact that's meaningful. But even within your own school, changing the policies around how stressful school is, what kind of support that young people can actually get, the classmates and your schoolmates can actually get within the school. That's impact. That's huge impact. And going beyond the school to the community itself, how are you interacting with community policymakers and duty bearers, and even your home. What does it look like? What kind of conversation are you having with your parents? If you say you want to go see a therapist, how would they react to it? What about your friends? What about your cousins and your grandmothers and your grandparents who are much more, probably less open to the conversation as younger folks are? So starting from your own, it's like they say, charity begins at home. And I'm not sure what exactly that means, but I'm pretty sure it applies to something like this. To make sure that you start small. It's okay to start small. It's okay to start with the very place that you're from, and then you can take it big. But always find people who are just as passionate as you, because it's a very stressful thing. You can get very discouraged when you start this journey. I'm sure you know that, Vinny. Like, it's such a very, I mean, it's rewarding in its way, but sometimes like you look at the amount of time and sacrifices you have to make and think, how exactly can I sustain this beyond now? I don't see this. Nothing is changing. I've done everything possible in the past 8 years and nothing has changed. So what am I doing? Am I wasting my time? So being able to have people who can be on the same journey with you, who can keep you going, can encourage you, who you can have group support and peer support from, that's always the best way to go.
Amazing. And I mean, love this advice, especially for my sister. Start small. My birthday's coming up. You can always start with a gift for me. Just kidding. Anyways, yeah, I completely agree. I feel like every time we talk about advocacy, especially in the global setting, it's usually those big things, participating of these huge conferences and talking to just huge like leaders. But sometimes the best change you can do is really just across the street. And this really makes a lot of sense. So thank you for saying that. And yes, sis, the gift is on. But I think we're kind of like coming to an end in terms of the conversation. Oh, I know I can already see people mourning this end of this conversation. But again, I feel like there's still so much we can talk, but thank you so much for being available to have this conversation. I feel like your story with money and your own personal story and how your lived experience kind of like became a thing became your passion, your mission, and work, and it ended up trickling down to supporting more people, and that's very inspiring for me as a person. So thank you so much for that. And to kind of like wrap things up, do you have any two questions? Do you have any last comment? And the second question is, if people want to learn more about Victor, oh, I heard from Victor at the Hey Doc podcast. I'm so interested in his work. I want to. Where can they check you out? Like, is there any website, any LinkedIn, anything they can hear more from you?
Yeah, I'll probably start with that one. Yeah, I think I'm mostly just on LinkedIn and Instagram. Instagram is very private and family, but you can always find me on LinkedIn, Victor Ugo MD.
It's Ugo. If you write Hugo, you're not gonna find him. Okay.
Easy to find. In terms of Ugo, UGO. Yeah, yeah. And then in terms of the last comment, I think it's something I think when I was when I was talking about stigma as a consequence, it's something that I think is one of my newest passion. One of the systemic barriers to conquering stigma, I would say, is the language of mental health and the diagnostic models that we have, when it comes to classification of mental health. We have the DSM-5 from the APA in the US, we have the ICD-11 from WHO. Like, what exactly about this language, which we have taken on English, we've taken on English as a language that we speak, but that's not really how everyone in the world speaks. So what exactly about that is something that we can own. So we actually I was working on a research with a couple of friends called Mind Your Words, and we were going to do a pilot in Nigeria where we're not going to look at the classification system of mental health. We're just going to go down to the community and just ask grandmothers and children, because those are your markers. If a grandmother and a child can understand you, then you're there. You're at least 90% there. So we want to ask them exactly what are some of the ups and downs. There has been over a longer time, just really going down to the roots to find exactly. We were looking at depression as a start and anxiety, and just thinking what are the ways that they can use our local language to define how they feel differently without naming it depression or anxiety. Because I feel like if something is a mystery to you, and I'm going to end with this, if something is a mystery to you, if it's something that you're not used to, if it's a language and a word and a term and an action that is fresh, alien to you, you either embrace it completely as a supernatural concept and a model, which is what most of our religion is built on, that hope, or you fear it completely. And fear is one of the foundations of stigma. So when you look at the language, if it's something that we haven't completely come to understand or accept, we're afraid of it. We're afraid of whatever is associated with this word or this action or this phrasing. And that's one of the biggest foundations for stigma that we have. So it's not very much of a positive way to end, but I just thought it's something that we needed to know.
Bye, everyone. Yeah, no, it's very interesting. How do we make sure that we have evidence based like research and practices that make sense for like in the context and in the community? It makes a lot of sense. How it's always this question that comes up: how do we keep the evidence based approach? But here, like in my street, in my community, in my country, in with my language, with my people, and that's episode 2, everyone. So thank you so much, Victor, for being here. I absolutely loved it. Had a blast. Thank you so much, everyone who's been listening so far. This has been such a great conversation. If you have any questions, if you have any comments, if you have any suggestions, anyone you'd like to see here, just send us a DM. Oh, I have to do this marketing thing. It's like there's an Instagram page. It's called @HeyDoc Podcast without an H. Remember, you're in Brazil, so we don't have an H here for hey. It's like A. So HeyDoc Podcast on Instagram. Just follow us over there. Send a message. I'd love to keep having this conversation. And as a quick finalizing thing, as a quick final thing. Bye.
Oh, thank you so much for having me, Vinny.